Hello everyone, this video is about diabetes mellitus. Introduction. A disease that results in too much sugar in the blood, high blood glucose. Types: Type 1 insulin sensitive, Type 2 insulin resistant. Mode: maturity onset diabetes of young. Criteria for diagnosis: symptoms plus random alone sugar more than 200 mg or fasting more than 125 mg. After 2 hour GTT, glucose tolerance tends more than 200 mg. Pathogenesis: Type 1 autoimmune factors, insulitis, immunological marker islet cell antibodies, environmental coccoxavirus and rubella. Type 2 impaired secretions, peripheral insulin resistance, excessive hepatic glucose production. MODY homozygous mutation of glucokinase. Complication: acute diabetic ketoacidosis and hyperglycemic hyperosmolar coma. Chronic microvascular retinopathy, macular edema, sensory and motor mono or polyneuropathy, nephropathy. Macrovascular coronary artery disease, peripheral vascular disease, cerebral vascular disease. Others: GI, genitourinary, dermatological infections, cataract, glaucoma. Clinical features: Type 1 age less than 40, duration days 2 weeks, normal to wasted body habitudes, polyuria, polydipsia, polyphasia, plasma insulin low. Type 2 age more than 40 months, 2 year duration, obese, diabetic ketoacidosis, doesn't develop normal or increased plasma insulin. Benedict's test: if reducing sugar in glucose, it gives quantitative results: light green 0.1 to 0.5 gram, green 0.5 to 1 gram, yellow 1 to 2 gram, red more than 2 gram. Treatment: drugs: sulfonylurea, insulin secretagogue, chloropropamide 100 to 500 mg, tolbutamide 500 to 3000 mg, glibenclamide, glipizide 2.5 to 20 mg. Side effects: hypoglycemia, weight gain. Meglitinides, repaglinide, netaglinide, meglitinide 0.5 to 16 mg per day. Biguanides, metformin reduce hepatic glucose production and improve peripheral glucose utilization. Doesn't produce give weight gain, so useful in obese patient with type 2 diabetes mellitus. Started at dose of 500 mg twice a day and gradually increased to maximum of 1 gram thrice a day. Side effects: acidosis, anorexia, diarrhea. Metabolic test: alpha glucosidase inhibitors, acarbose and miglitol 25 mg inhibits alpha glucosidase enzymes, leads to poor absorption of carbohydrates, thereby causing reduced rise in postprandial glucose. Thiazolidinidines, rosiglitazone 2 to 8 mg OD, pioglitazone 15 to 25 mg per day. The bind to peroximum proliferator activated receptor that regulates transcription of genes involved in lipid metabolism and insulin action. This promotes adipocyte differentiation and reduce insulin resistance. Side effects: weight gain. Others: glucagon like peptide 1 analog, dipeptidyl peptidase 4 inhibitor, vildagliptin and sitagliptin. Insulin was discovered in 1921. Until 1980, it was obtained by extraction and purification from pancreas of cow and pig. The use of recombinant DNA technology has enabled large-scale production of human insulin. It has transformed the management of type 1 diabetes mellitus. Classification: it is classified as per duration of action, all figures in hours. Rapid onset 0.5, peak 0.5 to 2.5, duration 3 to 4.5 hours. Short onset 0.5 to 1 hour, peak 1 to 4 hour, duration 4 to 8 hour. Intermediate onset 1 to 3 hour, peak 3 to 8 hour, duration 7 to 14 hour. Long acting onset 2 to 4 hour, peak 6 to 12 hour, durations 12 to 30 hours. Long acting insulin analogs onset 1 to 2 hour, peak none, duration 18 to 24. Insulin delivery: it is injected subcutaneously into the anterior abdominal wall, upper arms, outer thigh and buttocks. The rate of absorption of insulin is influenced by many factors other than the insulin formulation, including the size, depth and volume of injection, skin temperature, local masses and exercise. Absorption is delayed from areas of Lipohypertrophy at injection sites, which results from the local trophic action of insulins. So repeated injections at the same site should be avoided. Short acting has to be injected at least 30 minutes before a meal. Fast acting onset can be administered immediately before food or even after meals. Once in blood, it has a half-life of few minutes. It is removed mainly by liver and also by kidneys. Insulin regimen. The choice of regimen depends on the desired degree of glycemic control, patient's lifestyle and ability to adjust the insulin dose. Most people require 2 or more injections of insulin daily. Once daily regimen is rarely sufficient. Twice daily administration of a short-acting and intermediate-acting insulin given in the combination before breakfast and evening meal is the simplest regimen and is still commonly used. Individual requirement vary considerably. Usually 2/3 of total daily dose is given in the morning in ratio of 1:2 short intermediate acting insulin. The remaining third is given in the evening. Side effects: hypoglycemia, weight gain, peripheral edema, insulin antibodies, local allergy, lipodystrophy at injection site. Down phenomena: it is fasting hypoglycemia caused by release of counter-regulatory hormones during the night as part of normal circadian rhythm, which increase insulin requirement.